Good morning to our audience as well. Happy Tuesday. I think we will go ahead and jump in here. So my name is Sohail Sood. I have the honor of serving as director of California's Children and Youth Behavioral Health Initiative. And welcome to this ongoing series entitled Transforming Together. We can jump to the next slide here. This is a space to zoom out, to lift up our head from the day-to-day and to recognize that as we work to improve the services and supports for young people, we need to keep in mind that the system itself is in need of reform. So in the past two webinars, hopefully many of you have been here for those, we've talked about how to align across entities to build some shared leadership structures so that the left hand and the right hand know what each other is doing. And by left hand, in some cases, I mean schools, and right hand, behavioral health, or it could be child welfare teams or probation teams or public health teams, many, many different actors in this ecosystem here. And we work better when we work together. So that was part one. Part two, chapter two, you can see the focus there was developing shared goals and centering those we serve. And today we're going to introduce and dive deeper into the concept of what we actually do and who does the work. So service arrays and workforce items. And then save the date for chapter 4, May 4th, where we'll close next month and discuss how might one contemplate aligning funding structures across systems to sustain this work. So appreciate your attention for the next hour and a half. We can jump to the next slide. We are using the Q&A feature. Feel free to put all your questions that you may have into the chat. There'll be structured moments in which our moderators will come on and facilitate a conversation around this. Everything's going to be recorded and available online. The first two parts of this webinar series are already accessible online, and we'll make sure you have links to those, if not immediately in the chat. And we can go to the next slide. So big team presenting here today. You can see many, many different agencies represented. It takes a village to really think through this work. So I'm so grateful for all the names you see on the screen, as well as everyone behind the scenes who's been part of the crew making this happen. We have James Soward, Elizabeth Estes, Richard Connect, Nicolette Carlos, Armando Lopez, Dr. Gordon Arakawa, Laura Krizwicki, Rachel Swakos, and Peter Guan, representing San Bernardino Departments of Public Health and County Superintendents Associations, Imperial County Office of Education, Community Health Plan of Imperial Valley, the Child and Family Policy Institute of California, Breaking Barriers and Integrated Human Services, a lot of different folks, as I mentioned. And without further ado, I will pass it over to James Howard from the San Bernardino Superintendent of Schools to lead us in the conversation here. Thanks again. Take care.
And thank you, Sohail. And we go to the next slide. Again, my name is James Soward from San Bernardino County Superintendent of Schools, where I work in a department called Healthy SBCSS, where we support our county districts in building their infrastructure around health and student health. And again, good morning to everyone. Appreciate you all for being here. And before we jump in, I want to just ground us in how today fits into the broader Transforming Together series, as Sohail was kind of speaking about. We started with shared leadership, then we moved into shared goals and outcomes. And today we're building on that foundation. Today is really about answering the question, now that we're aligned, what does the system actually deliver and how do we make it work together? Okay, so as we're going through this conversation, really use that essential question to guide you through this webinar today. We go to the next slide, Jameen. And then as we go to who this is for, who's this conversation for, this work is intentionally cross-sector, right? So whether you're coming from education, behavioral health, child welfare, probation, as Sohail was saying earlier, public health or community-based organizations, this space is for you, right? So we want to bring all the partners into this space because the reality is there's no one system and no one system can do this work alone. And families don't experience systems separately, right? They experience one system. So again, we want to make sure that we are accessible for our families. We go to the next slide. Just a recap and transition to chapter 3. In our previous sessions, we talked about how leadership must be shared, how goals must be aligned, and how we center youth and families in that work. But alignment alone doesn't change outcomes. Systems change when what we deliver and how we deliver it changes. Okay. So today we're going to focus on how we move from aligned systems to aligned service experience for children and families. Okay. So again, as we're going through this conversation, think about that question around, okay, we're aligned, but now what does the system actually deliver, and how do we make it work together as we go through this conversation? So I'll pass the mic over to Elizabeth.
Morning, everybody. So happy to see you all here. Thanks for joining. And right now, we're really going to get into the why, what, and how of building a universal array of services. And this is all, of course, information that's in the Transforming Together guide, which we provided a link to. And so I am going to turn it over to talk about the why to Richard Connect, who is doing this work statewide. So I'll turn it over to Richard.
Hey, thanks, Elizabeth. Really great to be with you all and just ponder together for a minute or two on the imperative that we share to transform the system from the highest level. From a perspective standpoint, for decades, we have sought to solve our challenges in effectiveness and efficiency from the belief, overly simplified belief, that if we put more money into some sector, we can fix a problem. And we have kind of demonstrable evidence now after more than 4 decades in California in particular that that's just not the answer alone. So we're really talking about defragmenting the system. That's the imperative that we share. Go ahead and advance us to the next slide if you would. The underneath that imperative, there are a whole kind of set of results or outputs that we create by being in a fragmented system. Among them, this is not a comprehensive list, but among them, obviously the real impact is that kids and families that are in need fall through the gaps, right? They don't get the services that they need. We often find ourselves in scenarios where the parts of the system are duplicative, and so we are not using resources wisely and using them in ways that are inefficient. Of significant impact, particularly in the last decade or so, we've become aware that a combination of those factors with others results in tremendous inequity in terms of access to care. We have a fragmented system in California that historically overrepresents communities of color often, and underrepresents the access in terms of access. So we're extraordinarily out of balance. That inequity results in profound harm to communities, right? So that's a critical driver to this imperative. Obviously, if we're not aligned, we can't have an aligned crisis response, and so we often end up in crisis situations. And if you're in a county system, you might recognize this scenario whereby there's a family in crisis, and we look around the room, proverbially speaking, and we say, well, that's the other department's problem, right? That kid belongs to X, Y, or Z, instead of having a crisis response system that suggests, what are we going to do on behalf of this family because their need is immediate and acute, right? Obviously, driving this imperative further is the reality that we undermine our own program sustainability. So we're on constant treadmills of grant seeking, funding seeking. The long-term trajectory to that results in tremendous burnout for us as system leaders, because we spend more time chasing dollars and implementing initiatives rather than doing great work with kids and families. And that trickles down. And so the last of our impacts in terms of outcomes to our fragmented system is that we all experience more secondary kind of vicarious trauma than we need to, right? It's inherent in the work. And we're all prepared to deal with that. But when we make it worse by being in a fragmented system, we're not doing ourselves any favors. Next slide. What authentic and sustained integration suggests is that there are outputs or outcomes that come from that. And these are all rooted in research. Many of you are familiar with this at this point. It comes from wraparound, it comes from multi-tiered systems of support, it comes from system of care researchers. Lots of collective impact research suggests that when one entity can form and wrap itself in a structure, shared function, and shared vision, we get impact. And so what we'll see inevitably when we do this difficult work of transformation is that we align our roles through that shared leadership structure. We have an anchored agreement, and then we collaborate deeply in a host of functional areas to create the impact that's desired. And the implementation guide that we're talking about outlines how to do that, right? We're getting to the nuts and bolts of that. Inevitably, when we do that well, we're going to close those gaps. And so we'll begin to give more than lip service to this idea of no wrong door or closed loop referral, right? This is the fundamental imperative of kind of all systems. I'm reminded around whenever we talk about care coordination, the long-standing gold standard is the Joint Commission for Accreditation of Healthcare Organizations. You know them as JCAHO, right? And they have, for 60 years at least, been the standard. And they've got a 1,500 set of 1,500 standards of care. And by far the biggest chapter in that whole book is around care coordination, because that's the fundamental challenge to all this fragmentation, is to figure that out. So we're not alone on the government side. Private systems have been trying to close the gaps for decades as well. What we do when we are effective in closing those gaps is we develop this idea of a comprehensive or universal array that then suggests that we are sharing resources and responsibility and relationship and reward for kids in our communities, right? That results again in this kind of bottom line outcome, which suggests that we've increased access, we've reduced duplication and waste, we've created a much more responsive, effective, and equitable system of care. Next slide. So here's a quick look then at the kind of current system, if you will. And I like to use the singular form of that because it reminds me that we really are more aligned and alike than we sometimes feel when we work in these systems. But the invariable outcome is that kids can't get their needs met, regardless of what door they enter. There are many right doors, but there are also wrong doors based on the rules, right? The eligibility standards. Sometimes they're diagnostic, sometimes they're geographic, right? Like there are all sorts of things in place that keep kids from getting the care they need. And the transformative work of the ecosystem building is to make sure that those rules don't impact the kids and families, because we've been doing it that way for decades, right? So one more slide from me, and this is a look at what we kind of aspire to with the next slide, is that when we have a fully functioning ecosystem that has a universal array with a kind of a defragmented entry and a shared understanding about who our kids are, how they enter care, how we coordinate, how we share information, time, people, money, responsibility, then we get to a place where we can begin again to move beyond the lip service of whole child, whole student, whole person work into something that's much more faithful from a fidelity standpoint to this idea of no wrong door. And with that, I am going to pass, I think, back to James, right?
Yes, Mr. Connect, thank you very much. And Jameen, we go to the next slide. And as we are building this ecosystem that Ms. Connect just talked about, let's go to the next slide. We really want to start looking at it, again, from a tiered approach, this tier universal array. What we're introducing here is the idea of universal array of services, right? At its core, this is about creating a shared language, a shared understanding, and a shared responsibility across all systems that serve children and families. Because right now, systems define services differently, this framework brings coherence to how we do how we define need, how we allocate resources, and how we connect services across systems. Okay, let's go to the next slide. And we're going to be looking at the tiered framework, just an overview of it. You'll recognize this structure, especially from education, right? We call it the MTSS in education. But what's different here is this is not just an education framework anymore. This expands across behavioral health, child welfare, probation, public health, community partners. So now we're not just aligning within systems, we're aligning across systems. So take a moment to really look at this slide and really envision, again, how we work across systems and not only within our systems. Okay, and you're seeing that universal, where all of our constituents, our communities involved. We identify tier 2 of our folks who need a little more support, and then that intensive care, right? But we do this across systems. Jameen, we'll go to the next slide. I want to pause here because this is where we can understand the model, right? The tiers are not categories of kids, they are categories of support, right? Actually, Jameen, I'm sorry, go back one. So again, these are not the categories of kids, they are categories of support. Now, many times as a school administrator, we will say, oh, kids are tier 1 or kids are tier 2, kids are tier, but that is not the actual way that we should be looking at this. We should be looking at it as these tiers are the tiers of support, and then students, community members access these tiers of support, right? So a young person can be in multiple tiers at the same time. This is not linear, and it's not about moving kids up or down. It's about matching supports to need across systems at the same time, okay? So as we're looking at that, those levels are supports, and they're not people and or kids. Kids are people. Let's go to the next slide, Jameen. Tier 1 is where the system should be strongest. This is about prevention, early identification, and building protective factors. And the key here is these supports are universally accessible. Schools and communities become the primary access points. When we do tier 1 well, we reduce demand on more intensive services, and we create earlier, more equitable access. Okay, so this is where we want to spend most of our resourcing, our energy is really in building that prevention work. Let's go to the next slide. Tier 2 is where we respond. We should be on tier 2. Tier 2 is where we respond to emerging needs. These are more targeted, often short-term, and designed to stabilize and support before things escalate. This is also where coordination becomes critical, okay? So because supports may come from schools, behavioral health, community-based organizations, and this is where the no wrong door concept really starts to matter, right? As our people begin to need the next level of support, our students, our community members begin to need the next level of support, that we are coordinated in the way that they access these points. Let's go to the next slide. Tier 3 is for youth with the most complex needs. This requires multi-system involvement, integrated care planning, and sustained coordination. And when done well, this is where we reduce things like unnecessary placements, crisis cycling, and system involvement. This is where the system shows whether it can truly operate as one, right? So this is where the rubber really hits the road, where we are really looking at ensuring that the folks who need the most help are getting the actual help that they need. Let's go to the next slide. And as we're looking at that tier 3 and looking at this universal integration of universal services array, we see all of our partners having their own multi-tier system of support, or their own tier 1, tier 2, tier 3 within their system. As you're looking at this system here, this is how we currently function, right? Where all of our different partners, agencies, we are doing a preventative accessible point. We're doing some prevention at the universal level. We're doing some targeted support at the tier 2, and then we have an intensive support for our most needy or complex situations. But what we want to move to, and Jameen, if you press the button, the goal is not 3 separate tiers. The goal is one coordinated system where services are connected, roles are clear, and families don't have to navigate complexity on their own. So again, take a look at that, where we're moving, this idea is us moving from those siloed interventions or resourcing and really building one ecosystem where families are cared for from a larger lens and a larger coordinated approach. Okay, we go to the next slide. So I want to ground this in what it looks like in practice, especially here in San Bernardino. So I have my partner, Nicolette, who's going to be speaking with me. But what we've been working on is strengthening the Tier 1 foundation. And we're doing that by intentionally aligning education and public health. Because we recognize that conditions impact student success, and they don't start in the classroom, they start in the community, right? So our focus has been on building universal access points through school-based health and wellness centers, and not just through treatment, but for prevention, early intervention, and connection to supports, right? So what's been critical is aligning the language, aligning data, and aligning infrastructure across systems, right? And this connects directly back to that framework that I just showed you, right? Where we have universal access points at tier 1, targeted supports layered in, and then at tier 3, we have clear pathways. So what I want to do is I want to invite Nicolette to come in and to talk to all you participants about the work that we've started with San Bernardino with our community vital signs, and then connecting that back to what we're talking about with this array of services, universal array. Nicolette.
Thank you, James, and good morning, everyone. I'm Nicolette Carlos. I'm from the San Bernardino County Public Health Department, where I support the Community Vital Signs Initiative. So just to give a little context for everyone, San Bernardino County is a vast and diverse county, both geographically, economically, and culturally. It's a place with much diversity, from our mountain towns to desert communities and bustling cities to our rural farmlands. And so with diversity comes challenge, and different needs and different priorities are often, forming different conversations that tend to happen in isolation. And so for many years, different sectors such as nonprofit organizations, they focus on community needs, while our law enforcement worked on protection and safety. Schools concentrated on education, while the health departments focus on healthcare and population health. And so we all seem to work separately. And however, we weren't always aligned in our efforts. And so resources were stretched and initiatives overlapped, and our progress kind of felt slow. And so next slide, please. And so after following, everyone can remember the 2008 recession, the impact and consequences on our communities in San Bernardino hit on so many levels towards workforce, housing, education, and this brought our county leaders under all sectors to work in a unified way. So in 2011, our San Bernardino County Board of Supervisors and Council of Governments adopted the countywide vision. And this called for collaboration across all sectors to create a vibrant and physically and economically healthy county. So to reduce the duplication of efforts, the county now has shared goals, and this is made up of 10 elements: jobs and economy, education, housing, public safety, infrastructure, quality of life, environment, wellness, and water and image. And so guided by our community values and data-driven strategies, we are working all together to improve the quality of life for our county residents. Next slide, please. So at the time, the county's health outcomes were not the best. And so the Community Vital Signs Initiative, if you can hit next, was created to improve our county's wellness and health outcomes. As part of that vision into action, the Community Vital Signs Initiative was charged to implement the wellness element of the countywide vision. Putting community at the center of the work, it brings residents, organizations, and sectors together to address the root causes of poor health and build a healthier, more equitable future for our residents. And this provided a structure for our communities to lead a community health improvement plan where communities assess pressing health issues and align their resources across all sectors for action. Next slide, please. So through a community engagement process, the community prioritized key health issues, which then goals were established to address them. And these goals are housed under the San Bernardino County Community Transformation Plan, which provides a roadmap for coordination. The Community Transformation Plan is a 5-year plan, and it addresses the health priorities that were identified by the community. And these health priorities were behavioral health, chronic disease, and injury and violence prevention. And so the Community Transformation Plan provides a common understanding of health issues and factors that impact our communities. It's grounded in the voices of the community, and it guides community action, and it aligns multiple sectors and brings together stakeholders to improve county health outcomes. And so it sets shared goals and priorities for our action that is based on community health assessments, known as our CHA, and it also promotes policy, systems, and environmental changes. Next slide, please. So addressing the health priorities that the community identified through the community health assessment, each health priority has goals and strategies that aim to align resources, cultivate partnerships, and motivate action. And so the strategies under each health priority are how we turn our goals into action by focusing on what matters most, working together, and making real changes that help people live healthier and safer lives. And so to create a county where improving health outcomes is a priority in every decision made by our residents and organizations, we need to recognize the importance of adopting strategies that work across various levels of sectors. Next slide, please. The Community Vital Signs Initiative is a collective impact initiative. It harnesses the collective power of leaders, partners, community members working all together towards a shared common vision for providing all with the opportunity for better health. So to implement our goals, we emphasize collaboration to enhance our effectiveness, share insights to pinpoint overlapping initiatives and streamline efforts. We discuss challenges openly to tackle them systematically, and we minimize redundancy to create more efficient workflows and address systemic barriers. We also want to present a united front in funding pursuits by pooling resources and expertise, and identify areas for joint investment to strengthen proposals. Also establishing clear shared goals to unify our vision. We also provide regular updates to our partners and community that help us stay committed and adaptable. Next slide, please. And so our goal is to align our efforts with the countywide vision by working collectively with shared goals that build a culture of health throughout our county, and one that values collaboration, equity, and the voice of our communities. And the collective impact is awaits for different groups, including government and organizations, to team up and make real difference in improving health outcomes in the county. And it's all about working together to create a positive social change. And so through this approach, the partnership with San Bernardino County Superintendent of Schools has fostered collaboration across various sectors to address behavioral health challenges with our goal to increase the number of school-based health centers and student wellness centers, as well as to enhance their utilization as access points for mental health services, substance use screening and treatment, and other referrals for basic needs. And so under this initiative, San Bernardino County Superintendent of Schools is leading the effort. And these are some of the regional organizations that already have aligned their goals and are committed to this important work. And the next slide, please. So I'm going to turn it back over to James, who can discuss our current work and where we're going.
And thank you, Nicolette. So setting that tone of what Community Vital Signs is and what it's trying to accomplish, San Bernardino County Superintendent of Schools has been the facilitators of the conversation for the behavioral health category, behavioral health side of it. And so what we've been doing in leading that is ensuring that we have and that we talked about earlier, just that common knowledge or common language, right? Where we're calling a school-based health center and what we're calling a wellness center, just even in the room of partners that we have an understanding of what we're saying. So when someone says school-based health center, we're actually talking about the same thing, but not only inside of our room, but actually that we do that county-wide, right? So county-wide, and we're talking about a school-based health center, that we've defined that as a county as well as a wellness center. We've defined that. So what we've done is created a county-wide definition of those two strategies, right? Also identifying some of the data points that we want to address. And of course, with the language that empowers or informs the data so that we're actually looking at the same things, right? And so the result of that has been just a coordination of beginning this preventative focused system that we're trying to create. When we're talking about wellness centers, we're really discussing not where kids or students get to go to take a break, but where they actually get preventative services, where we're educating them, psychoeducation, physical education around their individual health. And then our school-based health centers, the way that we have defined those are interventions where things are actually happening, where services are actually occurring, right? So when our partners begin to say, I want to bring in a service, or I want to bring in an education or psychoeducation, or I want to help with prevention, we know where to send those folks and to build upon that. Let's go to the next slide. And so the how, again, I'm sorry, go back because this isn't me. I'm sorry. Just again, when we're looking at that go back one, Jimmy. Yeah, right there. When we're talking about how we have to develop the relationships, and that's really what we're describing here, is the relationships among education, public health, our managed care plans, our different agencies and partners, community-based organizations, building their relationship, understanding how each of our work benefits our community and the work that we have to do within our individual systems, and to begin to build those systems across partnerships rather than just within, and then trying to work alongside those, but really working within each other's work is really what we were describing. And so Community Vital Signs gives us the intention to really meet the countywide vision. And that's why Nicolette started with the countywide vision, having a shared vision. Now that Community Vital Signs supports that countywide vision, then the work that we do in behavioral health actually helps to be the actionable steps for us to accomplish that, all under the vision of our county. So I'm gonna move to the side and give it back to Elizabeth.
Okay, great. Thanks a lot, James. And thanks for really explaining the work on the ground in San Bernardino. So what I'm going to get into now is also, of course, in the guide, which is the how of approaching this universal array development. And as James just mentioned, we start with a shared vision, which we talked about in our chapter 1 webinar, and shared goals, which we talked in chapter 2. And now we're really talking about, but how do you align those services and supports and both community and agency-based resources in order to understand what we're holding and maximize utilization of those resources and supports towards the most robust outcomes that we can achieve by, for, and with our youth and families and those who are working to serve them. So I'm going to get into the parts of the chapter that really discuss the how. So we can get to the next slide. In the next slide, we just talk about an approach that we can take from stewardship to system design in order to build the conditions for a universal array, both identification and implementation. We evaluate our current system. And when we say that, we mean ecosystem. We mean not one, but we mean the multiple agencies. As James showed, the siloed, we call them multi-tiered system of support pyramids, but arrays of services and supports we have in each agency. And if you can put those together, then you can see tier 3, tier 2, and tier 1 resources across agencies with your shared governance, interagency governance structure on the outside, really stewarding a tapestry of services and supports that is accessible and transparent to families, like the slide that Richard showed earlier, versus asking them to go navigate all those pyramids separately. So we evaluate our current system. Then we define and identify what we're holding, like in our local array. We establish infrastructures such as that governance structure, which we talked about in chapter 1, in order to hold like all of this work in a collective interagency governance structure. Then we implement and we integrate, and then we monitor and adapt. And one of the things that we really want to note in this work is, A, it is very, very hard work. B, it takes time. It's going to take time for us to do this work together. The systems have not really operated together for decades. And so we are now, as Richard mentioned, operating in a different way to actually transform how we provide services and supports to children and families and to those who are serving and supporting them, because we're frustrated by our silos. We get frustrated even in our silos when we cannot best get children and families what they need when they need it and build the most successful conditions for success. So, but this takes time. This is hard work. It's work that requires adaptation over time, and it always will. It's a new way of operating into the future and beyond. So we want to be able to really recognize that and give ourselves the grace to do this work together. Next slide. When we talk about evaluating the current system, we do that by conducting a comprehensive landscape analysis to really understand our current ecosystem resources and supports. And we can approach that by thinking about those multi-tiered system of support pyramids in each agency. What are the resources that you're holding, and how can you make those transparent to other agencies who may or may not know what they are? And this includes community-based organizations and community partners. We have tools in the toolkit, in the guide, that can help us do this work. We have an initiative inventory. Often our services and supports are mapped through an initiative. They're mapped because we got a funding stream in an initiative to provide a certain array of services and supports. But those can be mapped into a multi-tiered system of support pyramid. And so we do have in the guide a tool, the initiative inventory, that can help the field map initiatives to identify alignment opportunities. In the guide, we also have other examples of how this work can be done alongside and with community schools' asset maps, which are currently happening out in the field, county resource inventories, which are currently happening out in the field. There is a lot of information being gathered on resources that are available, services and supports that are available to children and families. And this is about identifying that and uniting them in this universal array. We also have an initiative inventory mapping tool in Chapter 3 that you can utilize, and that some of our counties in the field are currently utilizing. And there's a link to that here as well. Next slide. As we're analyzing our current system and identifying services and supports that are available, we also can approach this through workforce alignment. So within the context of the guide, we also have a tool that is sample roles by tier, which is a list of roles that commonly anchor services at each level, universal, targeted, and intensive. And that tool can be used to identify what services and supports people are offering in order to map arrays of services. So we have multiple tools in the guide that can be utilized to be doing this work. We have some key questions for the interagency leadership teams and the executive advisory committees that are doing implementation work in counties that allow us to really drive the conversation. So what will it take from staffing, training, and resources to uphold a truly universal array and a no rolling door ecosystem, in our county? And then how can we collectively sustain coverage and coordination when we have inevitable workforce fluctuations? And that actually gets to the end of that implementation pyramid that ladder that I just showed, where you have ongoing evaluation of your current ecosystem and your universal array of services and supports as those are changing, as workforce is shifting. And we, as Richard mentioned, can provide a more robust service array if we're able to weather these changes in the system by utilizing the resources of all of the agencies together, as opposed to working in silos. Next slide. First, we evaluate the current system. Second, we're going to really work to define your local array. And as I just pointed out, again, this is ongoing work. This is going to be changing over time. But you can outline the universal, targeted, and intensive services that you are holding within your agencies. And the best people to do that are the people in the agencies themselves, because they know their arrays. Then those can be put together into the universal array that we showed in the graphic, the interactive graphic that James showed. We have in the guide, the key ecosystem roles map, the local initiative inventories, which I already referenced. And then we have the primary, secondary, and contributing agencies resource also in the guide that can be utilized in order to map your ecosystem and your universal array. And that helps delineate agencies by who they serve so that we can have transparency on who serves what population. There is a lot of cross-training that happens at this stage of this work so that you can understand each other's systems in building an ecosystem. And again, that takes time, that takes patience, that takes intention. It's intention that starts in Chapter 1 with a shared mission and vision that we will collectively serve children, youth, and families by, for, and with them, and by, for, and with those who are working to serve and support them. You can go to the next slide. We need, as we're doing this work, to establish the infrastructure to hold all of this universal array design and ongoing monitoring and evaluation. So this comes back to developing and strengthening our ILTs, our MOUs, and our cross-agency information sharing protocols. Those need to be evaluated as we're building out our universal arrays. The information that's being developed in universal array development needs to be coming back to your ILT. And you also need to be revisiting your MOU, your memorandums of understanding, to ensure that you really understand who is going to be responsible for holding this work? What is your interagency team at the interagency leadership level and at the implementation level, who's going to be holding this work? And then who has clear decision-making authority regarding uniting resources and allocations that are necessary in order to build the most robust universal array possible for children, youth, families, and those who are serving and supporting them. We have an ecosystem action plan, which we actually also reference in Chapter 1, which is really an action plan for implementation of this work all the way from ILT building through universal array development. And that is in the guide as a resource. And we also have some examples of interagency agreements that are incorporated therein. We can go to the next slide. After we identify our arrays, and again, this is ongoing work, and we ensure that everything has come back to our leadership structure as we're building this, we're going to implement and we're going to integrate our services so that we can have transparency and care navigation and cross-sector care management and team-based coordination practices, not only at your interagency leadership team level and then at your executive advisory committee level, but at your sites. At your sites, where you imagine where we have interagency teams that are able to really wrap ourselves around our children, youth, and families together in the most robust way possible, and that also have transparency on what our universal array is and how youth and families can access those services and which agencies are responsible for those services. And this does require training and coaching. It requires operating in a different way. It is doable. It is possible. As Richard mentioned, it is necessary for all of us. It will make our jobs easier in serving and supporting, and it will make access better for children, youth, and families. And with that, I want to go to slide 36, our next slide. I'm excited to turn this over to CFPIC, and I'll let them introduce themselves, but to talk about a practice spotlight tool that we have in the guide that can really facilitate not only the identification of universal array, but also the accessibility of that so that care navigators can really identify what services and supports are available to children, youth, and families in their systems. So I'm going to turn it over to, I think it's Laura or Peter now.
Thank you, Elizabeth. Hi, everyone. My name is Laura Krzwicki. I'm a program director here at CFPIC. Thanks for letting us present and share our tool today. Our vision at our capacity building for system integration team here at CFPIC is to support system of care leadership by helping them advance partnerships across all child and family serving systems. And the goals of our capacity building for system integration team are to enhance the care continuum for children and youth, particularly those with complex care needs who are involved in multiple systems. And with those visions and goals in mind, we developed this tool to help enhance learning and coordination amongst the system of care partners in order to serve families in the most streamlined way. Across systems, we consistently hear the same challenge, that there are services that exist, but they're difficult to navigate. And even the most experienced providers can struggle to see the full picture of what's available across multiple agencies. At its core, this coordination tool helps visualize the full landscape of services available to children and youth with complex care needs. And from a systems perspective, it leverages technology to support stronger resource coordination, which is vital and critical and something we've heard mentioned throughout our time here this morning. And it's also essential for moving beyond siloed approaches. Our tool was created with subject matter experts within CFPIC and system of care agencies such as education, probation, behavioral health, regional center, and child welfare services. It was reviewed by contributing county advocacy groups and associated state departments. The use for this tool is for, again, system of care partners but also direct service staff to learn about other departments, what other resources are out there that education or regional center provide for a family and youth that they're working with. Interagency leadership teams, tribal partners, caregivers, and others who are interested in supporting children and youth with complex care needs and want to learn about resources and placement options available for them. The tool is in the initial stages of development and will later focus on a build out to include some fiscal components and potentially also county specific resources available to those children in those regions. And then I will turn it over to Peter.
All right, thanks, Laura. I'm just gonna briefly go through the tool, just the layout of the tool, and I'll pass it on to my colleague Rachel, who will provide a direct example of the tool. All right, so this is just our CVSI webpage. To find our tool, you just simply go to this square to the right over here, click on System of Care Coordination tool. And once you're in, this is the layout of the tool. To the top left, you just have a couple of demographic questions. We use this data to better tailor the tool moving forward, so we can make sure that it's applicable to the users as much as possible. So let's just say we're child welfare services, or actually let's just say we're education, and we are leadership management. And below that, this is where all the magic happens. We have two filters. The one on the left is one that's more generalized versus the one on the right is more specific. So if you're in a time crunch, you can always use the one on the left. They pretty much do the same thing, except the one on the right offers more specificity. So on the left, if you choose certain systems that you would like resources from, and then below you have option of services replacement options. So as you can see, as I'm making my selections, the results populate automatically. And alternatively, you can clear your search and you can go to the one on the right as well. You can make your selections and as well, and we have more specific filters. So if you're looking for maybe absent from care, respite, permanency, things of that sort, you can always make more specific selections. On the right, you have your whole list of resources. We have services designated by the S and placement types designated by the P. And then we have description of service, program criteria, the lead agency, and other associated partners. And over here, you can expand each of the resources and you can see the entire view as along with any of the specific keywords that you made selections in as well. And you can also, we have two ways of getting your research results. One of them is you can either print or you can email it to yourself. Let's just say I'm making a few selections that I can do by individually clicking on the resources or the entire page. Or if I want to select everything, there are 2 pages in total, I can click on select all over here. And I can either print it by clicking here, or I can email it to myself. Just a quick note too is we do quarterly checks with our system partner to make sure that all these resources are as up to date as possible. But if you do notice something that may need updating or any technical issues, you can click on the report issue button here, fill out the information, and someone from our team will get to it as soon as possible. And if you want a full comprehensive tutorial, you can always click over here to the top right-hand button, learn to use this tool, and it is a recorded video of the tool tutorial. And with that being said, I will pass it on to Rachel for a specific example.
Hi, everyone. I love everything that you guys are talking about today as you're sitting and talking about your universal array of services and how would you use this tool to help support that. If you're looking at maybe as a leader who's been tasked with being responsible for learning about and integrating this array of services, we're looking really this tool at that tier 3 level services, those integrated intensive supports, and you're figuring out, how do I know about those? How do I know what my partners have to offer so that I can start working on the leadership team integrating them here for our students or the youth that we're serving? I'm going to go through. Peter already worked with you on looking at yourself as an education provider. You're in leadership, but you wanna learn more because you've just been tasked with creating this system of care, this ecosystem of care, who looks at these intensive services and learning about them. And you could go through and learn about them system by system. So let's say you're pretty familiar with behavioral health, you know what they offer on your campuses, or you've partnered with them most, but really learning about child welfare services and maybe only hearing about them in a tertiary way before, and not knowing what services could they bring a youth who has complex care needs. And you could filter through this system. You can see I'm down to only 15 results here if I just want to generally learn about the services that child welfare has to offer. You guys know that you have student team meetings, but what is a child and family team meeting? And being able to open that up and read about it, see what are the similarities between what your system has to offer in meetings about students or clients and what does child welfare offer, and maybe where do those overlap? How could everybody get their needs met together? Because you can see this could cover behavioral health needs, education needs, developmental needs. So you're starting to learn on where to integrate what both systems have going on in service of one youth. You could look generally at, if you have youth, you're talking about those intensive integrative supports. Child welfare has something called intensive services foster care. Maybe you've been familiar with foster care at a different level before, but what's their intensive foster care support? Who could that be with? How long does it last? And you could start learning here about what that has to offer and whether or not it's something that your system wants to refer to, wants to talk about their leadership partners with, about how it becomes part of the array that you reference. Respite care, because you're not just serving a student or a pupil, you're serving their caregivers and their families, that whole child, whole family support that everybody's trying to offer. How could you support a caregiver who's there? So everything that you could learn about that your other systems have to bring to the table as well. But maybe on your sites, you really need to know something specific for a youth that you're serving at this time. Let's say that you have a kiddo who has, who has high risk sexualized behaviors. Maybe you're worried about trafficking on a school site or a severe mental health diagnosis, and you want to know what there is to offer that youth from all of the systems because you're trying to prevent entry into probation, but you know that this youth needs really intense services and supports. You could go through and see every level offered by every system before you go into a meeting with your leadership about that child, or before you have a meeting with that family to see how you could serve them. You could look at everything from daytime intensive treatment, which you may know may not be on a school site. And so you might have to look at your other system partners to serve an immediate need for that child then to be able to safely sustain in school at a later time. What crisis intervention services are there for at times that there's crisis? How does that overlap when a child is in school? And could they have crisis intervention in a school site, or is that just something for at home? And you could really start to learn about what services are out there and how to apply them to that youth. And like Peter was showing, let's say you wanted to learn about crisis intervention for mental health treatment, but more specifically community-based mobile crisis services. And you think wraparound. You've heard about wraparound, maybe you're not super familiar with it, or these more technical ones, intensive care coordination of the specialty mental health services. And you want to take a look, you see that child and family team referenced here that you've learned about before. And these are things that you want to bring to the team to talk about. How are we going to integrate our supports and services for the youth that we're going to discuss today when we're talking about serving them as a whole child or a whole student? You can either print everything that's selected and bring it to that team meeting physically if you guys are meeting in person, or maybe you email it to yourself, or you just bring up the tool while you guys are all around together and talking about this student, so that as a team you're reviewing and able to say, yes, we think that would serve our student. No, we don't think that would serve the client that we're working with right now, or we're not looking for something that intense. You could really use the tool to specify around a specific child and their needs, or to learn about the service array in the other systems as you are a leadership person figuring out how to do that integration. So please, I think Peter dropped the link in the chat so you can play around with it yourselves. Please share it out with your team members, both leadership and those at sites. And then I'm going to kick it back to Elizabeth.
Thanks so much for that presentation of the tool. I think I've used that tool in forums with care navigators in counties so that they can search young children and really try to identify through the tool what the services and supports are that might be available to them and the responsible agencies. And I know that CFPIC is adapting that tool as well as we do this work. So really exciting, and thanks so much. So next slide is to implement and expand. So we understand that as we're doing this work, it's always evolving. We're always reevaluating. The workforce is changing. And so one of the things that we need to be doing is as we're identifying and seeing workforce gaps is how to address those workforce gaps. And California has been doing a lot of work in this area. So in the guide, there are examples of various areas where we can expand opportunities to expand our workforce in the links that are included here. And again, this webinar is so that we can let you know what is in the guide, and you can be utilizing this in the field. You can also always reach out to any of us with questions about the guide or how to utilize the guide itself. Next slide. And lastly, we're going to monitor and adapt, as I already mentioned. This is going to be ongoing quality improvement and control and sustainability work, which we will get into in our next webinar. Chapter 4 will be about sustainability, shared financing, quality improvement and control, reciprocal accountability, shared information processes so that we can do this work together. But we will always be monitoring and adapting and creating this free feedback loop so that we can build, again, the most effective, transparent, accessible, robust ecosystem possible for our communities and ourselves and our children and our families. Next slide. The work will, as we do our monitoring, adapting, always come back to your interagency leadership teams and executive advisory committees so that you can be reevaluating. And again, we will get into this more in Chapter 4 in May in our next webinar. Next slide. Just mentioning lastly the conditions for implementation, the necessity of really aligning our resources, our information, our data, and having shared outcomes. Equity is foundational to this work, and investment in the people, process, and technology of this new operating infrastructure is critical, along with that shared mission and vision, just starting with that as our North Star. So with that, I am going to turn it over to Imperial County, who's going to talk about their work and their journey and their build. And I'm going to turn it over to Armando and Gordon to do that for us. So thanks so much.
All right. Thank you, Elizabeth, for that introduction and that information. Definitely resonates with what's happening in Imperial County. So happy to be here. Next slide, please. So we're going to talk a little bit just about our journey as we're starting this work here in Imperial County. So next slide. My name is Armando Lopez. I'm the Director of District and Community School Support here at the County Office of Education. And with me, I have Dr. Gordon Arakawa. He's the Chief Medical Officer for the Managed Health Plan of Imperial Valley. We're happy to be here to just share the story of the journey that we've been on and to, kind of just share our experience. So next slide. So Imperial County is one of the four demonstration counties that was selected to participate in Transforming Together. And so as we started this work and really starting to look into how do we create an ecosystem of care, knowing that the goal is to enhance behavioral health and overall being for students, especially those that are underserved in families. And so we started to ask the question, knowing that we're integrating community schools and CYBHI, what does this look like and what does it even mean as we started this conversation? Next slide. And so as Elizabeth was talking about the system design and talking about how to elevate the current system and really just looking at understanding our own system here at Imperial County and really starting to think through if we're going to be looking at this bigger system across Imperial County, we need to really start at looking at our own system within. And so Imperial County Office of Education developed a core group. So it's the leaders of the different departments within the County Office of Education to really start to analyze and really look at how are we working with schools and the community and how we're supporting them and how can we better work together to really start to think through this system of care and how we're going to be a part of this system. So that's just an early on picture of some of the departments coming together to really start to look at how we can start to think about this process. Next slide, please. So as we continued our journey, it took us time to get to the place of the integrated leadership team in meetings. I will say that as we were really wrapping our brains around the work that needed to happen, because there's a lot of learning that was taking place for us as we were attending the T2 CLWG meetings. And so this last August, we started our first ILT meeting where we had different agencies across the county that started to come together to really start to look at how are we going to first learn about the system of care that we're talking about, and how are we going to work together to really start to implement this here in Imperial County. And so through the development, next slide, please. Through the development of really just putting the pieces together and starting to really think through one AB 2083, as was referenced earlier, that's the system of care specifically for foster youth. And so how are we going to elevate that to really make it more meaningful for all youth in Imperial County and bringing together different agencies outside of the ones that are referenced in AB 2083. And so we started to really look deep into who are our partners that we need to bring to the table to start to have this conversation. So here's some photos of those teams that as we started to think through who needs to be at the table, we're starting to document and take pictures of the work that we're doing as we're getting started with this work. Next slide. And here's just an image of the agencies that are currently participating with the structure that we're building here in Imperial County. It went from the original 5 that were part of the AB 2083, and we've gone out to have more, almost 10 agencies that are participating and really thinking through who else needs to be at the table when we're having this conversation. But as Elizabeth mentioned, this takes time. And so if we can go to the next slide, please. And as we're starting to think about how we're working together and really thinking through the structure of the ILT and the Executive Advisory Committee, as we started our work, we were finding that it's easier said than done to say, let's bring people together, right? And so I'll reference this later on in some of our challenges, but not everyone really just was able to make our meetings as we started this work and really started to think through how are we going to capitalize on this work and the agencies that need to participate because we didn't have early buy-in from everyone. And so as we started our work, one of the challenges that I'll address later on is just around trying to create an ILT structure and having an EAC and the folks that participate in the meetings that are the ones that are starting to do the work. And so it really allowed us to have a conversation. ILT, some of the leaders of the agencies were participating, and EAC, those that were doing the work, were in the same room at the same time having the conversations. So it wasn't an entire ILT and it wasn't an exactly EAC, but it was a combination of both. And that's just the structure that kind of was implemented here in Imperial County as we're starting to do this work. And we're looking at, now let's start to look at how do we start to define the local arrays. Next slide, please. And so as we started to do this work together and started to build the infrastructure of what we're trying to accomplish and really looking at we have the ILT agencies that we've identified. We have the executive advisory or executive action committees that we're working with to do this work and really building out the components and understanding our roles and how we want to create structure for Imperial County. So we are working towards identifying and really creating that structure of when will the ILT meet so that the leaders of the agencies are there so that they are the ones that are really looking at that governance body that have that shared vision and really seeing those priorities around the system of care that we're trying to do and really looking at aligning this work and the funding components. That's where the conversations are going to be happening around this, where the Executive Action Committee is really looking at doing that work, that operational oversight of the work that's happening and monitoring that implementation of the work that's being created as we're starting this structure here. Next slide, please. So I'm going to go ahead and turn it over to Dr. Arakawa so he can share a little bit more about maximizing efforts and sustainability.
Good morning, everyone. Thank you very much, Armando, and thank you for the opportunity to present. My name is Gordon Arakawa, and you'll notice that kind of came into in those picture sequence of pictures. You start seeing I made an appearance kind of halfway through, starting in the late summer, but been embraced and really hit the ground running. So with this slide, I really want to comment. I have a love-hate relationship with this slide. So as you can see, it's fairly attractive. It shows lots of curves. Lots of inputs and everything like that. But that's exactly the reason why I don't like it, because you've got lots of curves and lots of intersections and places where, basically things can go wrong. So in a sense, looking at this is a good target, but it's also the warning. So that being said, if we go to the next slide, I just wanted to talk about some guiding principles. And these are guiding principles that exist in my company. So this would be the Community Health Plan of Imperial Valley. It's something you do see in managed care, and in particular in Medi-Cal managed care. But the idea here is that you want to kind of look at some principles. And one of the principles is, just like Armando showed, we have a number of organizations that come in. And the idea is, how can you communicate what your organization or what the organization does really well? Because if you can do that very, very clearly, you get to inform the entire team that this organization says, I got this. I'm going to be responsible for transportation of students, right? For an example. It also helps to identify overlapping duplicative functions, right? So the idea is that maybe two organizations can handle transportation, but because we're Medi-Cal managed care, we can do Medi-Cal students very easily, but it's very difficult for us to do non-Medi-Cal. But another organization who is conflicting and says we can do transportation too, now they can save some resources because now they can basically just limit their transportation to a smaller population. So again, identifying these shows you where you have complementation and also duplicative functions that can be divided up. And then even then, if you don't see complementation, then you might identify true gaps. And this would be at the time where you say, do we need another organization? Or maybe one of the organizations that's moving on strong, can they have a branch that starts to reach out and say, you know what, we'll try to take care of that. Maybe with some grant bridge funding at first, but then it'll become something more permanent. But until you kind of do this landscape of analysis, which has been mentioned a couple of times in this webinar, you're not going to know where you move them. And then finally, giving a hint, hopefully I won't get scolded because I'm talking about the next chapter, but the idea here too, if you have an organization that has a particular skill and they do something very well, that oftentimes, not always, but oftentimes is tied to financial support. They've been doing it for a long time. They have a financial stream. So that tends to be a relationship that at least I have experience with. So next slide. And then the next kind of guiding principles for us is, how do you establish goals and targets, right? I know we've talked about lots of initiatives from different vantage points in the webinar so far, but the idea is, you want to be able to establish the goals that are appropriate to the community that you have. And so one way of looking at this is that you can look at them as top down versus bottom up. And so in top down, you basically say the ILT or the leadership team, the top team establishes goals and targets, right? They have a little bit of bearing of what's needed, but they're not really thinking how that's going to happen. You just want high level, good targets. And it's fine. I think that's a good input. At the same time, you can have a bottom-up approach. So this is in that landscape analysis where you're evaluating what organizations and companies do well, how they can contribute. That also identifies some potential goals, right? But it's from a bottom up. It's saying, we do this already, we can cover this in the student population. So the idea here is, if we can go to the next slide, is you want to make sure that as you're forming your goals, you really want to take advantage and leverage both approaches. So I don't know if you guys remember the original Reese's Pieces commercial, right? It's like, oh, I love chocolate and I love peanut butter. Then they crash, right? And it turns into the Reese's Peanut Butter Cup. That's kind of the approach here, is that you want to meld those two and kind of merge them so that in a sense, on the second step, you can reevaluate contributions from the participating organizations, and or you could identify opportunities to recruit additional organizations because gaps will be found in that approach. So I will stop there and I will hand this back to Armando. Thank you.
Thank you, Dr. Arakawa. Next slide, please. So as we're closing this up, we have had some challenges in really looking at structures and really taking the time to understand each other's roles and responsibility. It takes time, as Elizabeth mentioned. This is work that's going to take us a little bit longer to fully understand each other's roles. But really just understanding that we have an opportunity here, along with building relationships. How do we get to a place of understanding each other's roles so that we're not duplicating those specific services? Another challenge is just limited engagement with our tribal partners. That is something that we're working diligent with. And so we're very hopeful as we've had more conversations around how they're going to be able to participate in our structures and have more participation in the near future. And then just the capacity of competing priorities. As we're really diving deeper into this work, we know that everybody has their initial priorities that they're working with. So how are we working together to make sure that the vision of the county is the direction that we're all moving towards, and making sure that the right people are at the table to have those conversations? Next slide, please. So I've shared some of the successes that we've been talking about already, just in creating a core group at the county office, but similarly within the other agencies, and really analyzing their own individual structures to really help drive this forward. The development of the ILT and getting started with that process and that entity, and really starting the commitment of having committees that are now working on actionable components that we're going to be able to bring back to the ILT structured, and really talk about how are we doing with some of these components. The MOU is one of those components that we're really working towards to make sure that it gets updated with all of the agencies that are doing this work. We have that shared purpose that we talked about. We're engaging the different entities in a collaborative way with building relationships. We have identified priorities through the committees that was referenced. We're participating in the T2CLWG, doing lots of learning to be able to bring this work back to the county. Increased awareness of those supports and services that we were just talking about, that we're still needing to do some work there, but we've started that universal array and really mapping that out to better understand that work. And then we laid the groundwork for that sustainable structure. That is another one of our committees, and really looking through how, through the MOU, to be able to create that structure. So with that, next slide. I think we're just about wrapping this up. So here are just some of the next steps that we talked about that we have for ourselves, and really just finalizing that structure and the roles as we work this, strengthening the relationships, building that shared learning and the capacity around just the alignment through that universal array model to include the work that we're doing with AB 2083, and then just aligning the priorities areas and creating action through these committees that we started, and taking that back to the ILT for direction and some more work that's going to come our way. So I think that just wraps us up. Thank you so much for the time and allowing us to be here today. And I'll turn it back over to Elizabeth.
All right, great. Thank you so much. So great to see the work happening on the ground. And as I mentioned before, if anyone has questions of any of the presenters, all of our contact information is here, and you can feel free to reach out to anyone. We're all happy to answer questions on this work. But right now we're going to move into some reflection questions just to take away with you, and then an opportunity to ask a couple of questions, and then we're going to close. So some of the reflection questions are: how well do your current services function as a no wrong door in your system? Where do your families experience smooth coordination? And where do breakdowns occur? You can really do this work from looking at children, youth, and families who are very real examples on the ground. And you can use those as examples that you can then work with your ILT and your county teams on, in order to identify how to build transparent pathways for them. And that will enable you to really build out your universal array as well. Looking at those very, very real stories out in your communities. And to someone's point in the question, Paulina, I think, has a question about, the involvement of youth and families in the Q&A for parents and caregivers, and who genuinely want to do their best. Is it possible to prioritize them in support systems? And yes, in chapter 1 and chapter 2, we talked a lot about the importance of having families and youth be a part of your ecosystem building and your interagency leadership structures. And in chapter 4, we'll talk about your quality improvement and control, and your reciprocal accountability is dependent upon the incorporation of children and families in our infrastructures, as well as in our evaluation of how well we are providing services and supports, and how accessible and effective those are towards the goals that they have for themselves, and we all hold together. So the answer to that is yes, there is a way, and we have really emphasized that in this guide and put it in the early chapters of the guide. To what extent, coming back to our questions, to what extent do you have clearly defined shared universal array across agencies? Where are your gaps? Is your workforce equipped? And what sort of workforce opportunities are there in the current systems in California to build out your workforce and to have those roles transparent to one another across your agencies and your community? And what's one concrete step you can take to strengthen that array in the next 3 to 6 months? And finally, for purposes of this webinar, what are your questions? Can you add them? You can add them to the Q&A here, and we are going to do our best to answer them. And I'm going to ask everyone who presented to come on the screen, so that I feel like the questions are going to be multidisciplinary. And so we're all going to pop back on so that we're available to answer those questions for all of you. So here we go. I'm just going to the Q&A. Here we have a question. San Bernardino team mentioned a goal to increase school-based wellness centers and utilization of those if a child uses a wellness center and needs more tier 2 or tier 3 services. How exactly are they connected to resources from other agencies? Do the partners come on site? Do you refer them out? What roles does the public health team play in that? And I'll just note we have about like 6 minutes of Q&A. So I don't know if James, if you want to maybe discuss that.
Yeah, so right now we're in the building stages of this work, but right now as we are, many of our school districts are two recipients of the Community Schools Grant, engaging with the community-based organizations around those school districts is the intention, right? So as we build these wellness centers, and again, this definition of the wellness center and school-based health center in our school districts beginning to adopt this. We are in the beginning stages of getting this to be adopted. Our intentions are that our students would become educated and understand their health. And then as they need more intensive supports, that then they would know how to access those school-based health centers as well. So yes, it would be our providers, and that's where we're working with public health, DBH, and some of our other community-based organizations who are doing some of these services to become partners, utilizing that fee schedule as well. So it can go really deep, utilizing the fee schedule and being an affiliated partner to actually provide the services for our students and be able to reimburse, but provide those services at the school. So our intention is to build that bigger system. We are really in the beginning stages of that to do that, but our intention is that our community-based organizations will provide services through affiliated partnership through the CYBHI that they can reimburse, and our kids get the services at schools.
Okay. And then we have a question. Collective action usually has a clear backbone. I'm going to ask this of Imperial. What have been the pros and cons of having COEs serve as backbones and catalysts for this work?
Yeah,
Armando.
yes, I think that through the COE lens, as we work with education, but also different departments work with CYBHI and just the understanding of those components. As a matter of fact, the county office is the lead for the fee schedule that's coming out, and all the districts are coming together as a cohort in that support. And so really understanding the landscape of both sides, education and understanding some of the public sectors and being able to bring people together. That is, I think, one of the strengths of the COE kind of being the backbone and being able to collaborate with everyone. The meetings have been held at the County Office of Education for the most part. We are the hosting agency to help support this work. And so I think just the relationships that come with the opportunity of bringing people together, the understanding of education and how we can work together to help support students and families and communities. The integration of community schools, as Jane mentioned, in the work, we have 37 schools that are community schools here locally within Imperial County, and the support that we do in there as well, and just kind of bringing it all together for a better understanding and collective effort, I think has been what's gone well.
And I also aligned with that is a question around just examples of how your universal array work. Like someone said, it's great that the transportation example that Dr. Awakawa gave us. It's great to have these examples of where that universal array landscape assessment has resulted in early wins. And they were just wondering if you have any others in Imperial.
I think that's why, I appreciated the question and just the examples that have been shared from San Bernardino. For Imperial County, we are early on in this work. So that is one example because it happened to come up in conversation as we had our ILT meeting. And so because of the structure that we are currently in and really looking at how we're working from defining the array and establishing the infrastructure, that was one win that we had just not last month, I think it was, in really starting to have that conversation. So that's really the example that we can share, and we're working towards better understanding that and how we can come together. One other thing that did come up was the Family First Prevention Services Act. As social services was talking about that and kind of leaning into that, that was another win for us there locally, where we were able to say, hey, by the way, we can help support in this way. And so we took an additional 25, 30 minutes to have that conversation because of the time and space that we had during the ILT meeting. So those are some of the smaller wins that we have, but we're still building that momentum to better really understand how we can have more examples like the transportation. So we're early on. So we're not as far as San Bernardino for sure.
Michael Butler asked, is it most important in setting up referral systems, consent, sharing data? In chapter 4, we're going to talk more about information sharing and all of that. So I'm going to wait for our next webinar on that one. But this last one, and this is just a yes or a no because we are out of time. Is anyone from San Bernardino or Imperial sharing a workforce? Meaning, do you have co-funded roles at all or no yet? Or is that a goal?
Just a goal. Certainly a goal.
It's a goal. Okay.
That's
San Bernardino, yes.
Yeah, that's a goal, but I do know that juvenile justice system does have agencies that are just starting to do this work already.
Awesome, exciting. Okay, thank you so much. I am gonna turn it over to James to just close us out for the next webinar, and really appreciate everyone being here today.
Yes, and just thank you, Elizabeth, for facilitating and all of our presenters. Just again, at ending the time, make sure we get out on time. As a reminder, our next session will focus on sustainability, how we actually maintain and finance this work that we've been talking about, and how we can finance that over time. So appreciate the time and the engagement today. Again, this is tough work, but also necessary work. So again, thank you all, and thank you for being a part of it. See you next webinar.